Welcome to the Unfazed, Unedited podcast, where we provide commentary on complicated topics in an uncomplicated format. I'm Dr. Shaunna Payne Gold. I go by she, her, hers pronouns, and I am with Dr. Lisa. And yeah, it's almost the end of June, which is mind blowing. Let me just leave it right there. Mind blowing.
Yes. Hi, everyone. Pronoun she, hers. It is mind blowing, and I'd rather not dwell on the fact that it is almost the end of June so that I don't have another existential crisis about how quickly 2024 is going. But we have some fun trips coming up here very shortly, you and I. So that is a
Mm-hmm.
good thing. That is a good thing.
Mm-hmm. Yes, so we should calculate that, Lisa. We should like see how many miles apart we're going to be for like, I mean, we're already miles apart with, Maryland and Colorado, but it's going to get even worse pretty soon. So yeah, but we can compare notes when we get back. Maybe we can compare notes on the podcast. We'll see, but lots of stuff to chit chat about. But uh, good to be with you once again. We're going to pop into the word of the week. And the word of the week for us is tone policing. Tone policing. Maybe you've heard this before in the workplace. But what I think is really important to know about tone policing, because if you've ever taken a class on communication, or even you've been possibly quote unquote checked on how you communicate with people, tone policing may have come up. And this means when someone is really trying to downplay or diminish the importance of what you're saying by specifically addressing and possibly even attacking the tone with which it was said instead of the actual content, what you're saying, right? So, Lisa, if I say your performance sucks at work and I use a bunch of expletives, that may be true. We all know that's not in real life. But if my content is true and I'm really nasty about it versus just giving you the straight and narrow of it, this is what it is. Let me give you some concrete facts and some examples of the poor performance, and then moving forward, it will be experienced differently. Now, here's the rub, y'all. Here's the rub. The rub on top of that is, unfortunately, tone policing can be used to silence people. And I always say, I use the phrase, Lisa, you're running an interference on me. Whether I whisper that Lisa has bad performance or I scream that Lisa has loud performance, that she has bad performance, the content of what I'm saying is still accurate. But let's divert ourselves, let's divert our attention from the message and try to implicate the way in which it was delivered. It is often used as a tactic with women and people of color. So, what I think is so interesting, Lisa, you and I have seen this countless times as we've watched congressional hearings. Those have been some of the best places to see tone policing, y'all, on display, because whether you're confirming a Supreme Court justice or it's just a hearing, it's so interesting to me that man can be screaming at the top of his lungs and he's passionate. A woman or a person of color can say the exact same thing and they are hysterical. They are problematic. So it's making the individual the problem rather than facing the content. So for me, tone policing gets my goat every single time. It's so frustrating because I know it's a diversion tactic. And so people want to implicate tone rather than grappling with the reality of the delivery. And that becomes the problem.
Mm.
Good diversion.
Yeah. Yeah, it's a great diversion, but it's highly problematic, right? And so for folks who are listening and maybe unfamiliar with this, perk up your ears when you're in the workplace and see how more frequently you might notice comments about the way someone communicates, particularly if they have an oppressed identity, right? Like the
Mm-hmm.
what was said was inappropriate or not very nice,
Mm-hmm.
right? Or
Mm-hmm.
they're too direct or too aggressive. Um,
Right.
See if
Right.
you can start to see those patterns. Yeah.
Yeah, yeah, absolutely. Well, and then, not to take us too far down the road on this one, also notice the insatiables around tone policing, right? So if Lisa, the woman, Shaunna, the Black woman, say the same thing with passion, they're problematic and damn near hysterical. If Lisa, the white woman, Shaunna, the Black woman, says something more meekly, more downtoned, then maybe there's no care about the job, or maybe they're not equipped to communicate well. But either way, we didn't do it right. So it's literally a damned if you do, damned if you don't situation when it comes to communication practices. So just be aware, and I love what you said about that. Just perk up and pay attention to when that's happening, both in person, verbally, and also in writing. It can happen lots of different places, right? So, all right, well, let's jump right into phase one. Phase one. So I was really paying attention to what's been going on LinkedIn. And let me first just say super, super kudos to Wheaton, Greer, and Wells, who have created a visual for us to better understand the Black woman's employee life cycle. I thought it was wonderful and a huge statement that the visual has now been created for people that have been completely oblivious to the challenges of Black women in the workplace. I'm so grateful that somebody's finally trying to figure this out, right? And of course, with all good things, including visuals, we have multiple iterations of them to tweak, improve, change, just adjust, rethink. And so I'm so grateful that there's this Black woman employee life cycle that we'll share, and certainly tag the authors and the creators of this visual, because that's really important. And at the same time, Lisa and I have been through doctoral programs in the United States of America, which means we have been ingrained with critique. That's how we learn. That's how we grow. That's all the thing. It is a love language among scholars to critique sometimes, if you will. And so, given that, what I just wanted to highlight about the visual, we'll actually share a link in the show notes, and we'll also share it on our social media platforms. But there's 4 different quadrants that you can see in this visual. There's the recruitment onboarding, then the optimistic employee, burnout, and then the last quarter is exit, repeat, or stay. And Lisa, I've shared this visual with you, and let me just say that I know that I'm a bit jaded when it comes to this visual, even though it's about Black women, it's created by Black women. Recently, in this calendar year, unfortunately, we had the unfortunate passing of Dr. Bonnie Candia Bailey, who had been publicly ridiculed, had written a public letter about the bullying that she was experiencing that was directly affecting her mental health and so forth. We've talked about her on this podcast, and unfortunately she took her own life on January 8th, and it just sparked an outrage in regards to the lack of responsiveness. And so when I looked at this particular visual, when I saw exit, repeat, a couple of the different categories underneath there was being pushed out, which is absolutely the case. Lisa, you and I have talked about this ad nauseum when it comes to chief diversity officers, but frankly, it could be in any role. Being pushed out, having some type of mental health exit because of what they are experiencing. And when I saw that mental health exit, I know some people may think that, they need to leave and take care of themselves. But when it comes to Dr. Bonnie and her experience, we know that she left in a very different way. And so with that, I'm just very sensitive to this particular visual and want to name how wonderful it is. And yet at the same time, for any non-Black person, anyone who's not a woman who's trying to understand this, just know that this is the kindergarten version of what women are actually experiencing, that Black women took their time to educate you on in a more uh, understandable way, knowing that it is much more complex than this. And so I appreciate their efforts to educate other folks and doing the labor of educating other folks, and at the same time, inviting people into our nuance, Lisa, when it comes to this particular visual. But how did this land on you? And I'm sure this resonated with you from a woman perspective, but how would you
Right.
kind of critique this particular wheel here?
It definitely resonated from a woman perspective. I actually don't know that I'm in a position to critique it to the same degree that you are, given that I am a white woman. what I did find annoying, upsetting, was the authors shared on LinkedIn that they now list their names in the center of the circle, right, of the image, because they had originally listed it underneath at the bottom, which makes sense to me. That's probably where I would have put my name. But so many times their names and attribution had got cut off. And so then their image was circulating as an educational tool, but without the appropriate recognition of who created it. And so I just was like, well, there's a perfect illustration of what they're trying to articulate, right? They have come together over in a Zoom call, I think, kind of talking about this, and they developed and grew this image, which I think is kind of how you and I work, right? We talk through things and then we're like, we could create an image. And then their names get removed from it, right? And so people had been tagging them, and now they've made this amendment, but they shouldn't have had to make the amendment. They shouldn't have to put their names and handles, Twitter handles or whatever, in the center of the image, because people should have enough respect to not circulate their intellectual property without their knowledge or name. So anyway, that was annoying to me that people did that. So, but I think, I think one of the areas I see might need a little more teasing out, and this might also be very individualized, right? Like, not every person is going to have the same experience. But I think that there is probably a part in here, and you and I have talked about this, that is the optimistic employee, this idea that someone is like, things are going to be better this time. I'm going to work really hard. I am going to be the leader of an employee resource group. I'm going to offer my expertise, right? I am going to be the joiner, right? I'm going to be optimistic. This is going to be different. I think that exists, but I don't think it's as big, perhaps, as the image depicts, because I think there's also probably another piece to that where optimism maybe shifts into resignation or pragmatism or survival, resilience, however you want to determine it, right? And I'm also not sure it happens in such a linear way. But then again, like, it's not my lived experience, but I would feel like I kind of like move backwards and forwards, right? As a woman, like maybe some days I'm feeling really invested and optimistic, and then the next day I feel burned out, and then I'm at the like, what is it? What does it matter? No one gives a shit. I'm not getting paid enough, right? And I'm kind of bouncing backwards and forwards. I don't know.
Mm-hmm. Mm-hmm. No, you're dead on with what I was thinking about, just this entire process being very cyclical, in that, for example, the recruitment and onboarding piece, let's add hiring in there, because I would love to be the fly on the wall listening to the conversations about how did you make the decision to hire me or some other Black woman. So that wasn't necessarily in here. One of my good friends who studies, she's actually a historian, and so she studies very obscure Black women and descendants of enslaved people in her writing. And she's constantly said, no, I'm not going to say microaggressions anymore. They are always macro when they involve you. And so even with the microaggression piece, I would even take that out, and I wouldn't include microaggression, just aggression in general. The optimistic employee, I would certainly say when I was young and bright eyed and bushy tailed, starting out in my career in education specifically, I was optimistic. I still have hope, but my hope is different from optimism, meaning that optimism was, oh, this can certainly happen. It can happen in my lifetime. It can happen right now if we want it to. Now, my hope is in generations that I don't see, things will be different. And that comes with time and experience. And, as my 98-year-old grandmother says all the time, just live a little while, meaning you need some more lived experience in order to even interpret that appropriately. So I wouldn't even see that as optimistic anymore. I would see that as definitely survival. I would probably see it as pragmatic, meaning that there are going to be some people in your workplace, or even if you have saints in your workplace, there are going to be systems in your workplace that keep you from being able to be your full self there. The burnout piece, Black women, we hang out in burnout. We camp there. We build whole houses in burnout. Burnout builds our houses. How about that? That's where we hang out, where it literally gets to a place where, Lisa, I've mentioned it before on previous podcasts, where, gosh, I think it was within a month to 6 week time period, there were at least 3 African American female university presidents that passed away or were pushed out of their role. The president of Harvard was one of them, and there were 2 other presidents of, one was of a community college, one was at Temple University. All of that happens because, unfortunately, our lived experience is the burnout. And so I so appreciate this visual. And at the same time, for those that are taking it in, I want you to take it in and start there, but I don't want you to end there. That's that's my point with the visual. I don't want people working with African American women to stop at this visual, because this is just the scratching the surface. It kind of goes back to the iceberg conversation, Lisa, that we had a few episodes ago.
Yeah, and I do think for white allies or people who endeavor or strive to be a strong ally to Black women in the workplace, this tool, while not necessarily created for them, is a useful way to think about and understand the ways in which Black women are treated in your workplace, right? Like,
Mm-hmm.
this is real. And shifts or changes to varying degrees based on the things that you've shared.
Mm-hmm.
So yeah, I just love a good visual, right? I think it just really helps. It really helps people understand the depth of the experience, right?
Yeah,
Yeah.
yeah. Well, and I think I would add to that too and say that it may be for both, and it's for, as a Black woman looking at this visual, I appreciate that somebody sat down and visually articulated what we as a community have felt in the workplace for decades. And at the same time, it's to educate folks that are not within the Black woman community of, this is what your colleague is experiencing it. Now, just because she doesn't complain about it, that doesn't mean it's not happening. In fact, it's probably happening more because
Yeah.
she's choosing not to complain about it.
Right. Right.
So, given that, I think it's that educational tool that goes in lots of different directions for
Mm-hmm.
lots of different
Mm-hmm.
audiences, which is why I appreciate it even existing at this point. So, yeah.
Yeah. Well, I think that gives us actually a good segue into phase two. And what does
Mm-hmm.
that for me is the burnout piece, right? Because I
Oof.
think we've talked about this before, that burnout is often articulated as an individualized problem, as in, Shaunna, you just can't cut
Mm,
it, so there's something wrong with you, right? Versus saying or understanding that the reason why Shaunna is burned out is because the environment is hostile towards her, right? So the conditions do not exist for her to thrive and be successful. The conditions exist to beat her down and take away
mm-hmm,
her self confidence, right? And burn her out. So that
mm-hmm,
actually makes me think of the article that you shared with me, about society as a patient and how we think about the how we think about illness, right? As whether it is localized within the person or whether it is a product of society. So I think it would be really cool if you could just share a little bit about that article, that talks about this concept a little more.
yeah, yeah. So the society as patient, let me just share with you, kind of backing into how I discovered this conversation, was that I was looking at some research at the intersection of mental health providers and underrepresented populations that usually don't get those supports and those resources, right? And so, of course, we want to get down to the root of things. Why don't underrepresented populations, historically excluded persons, why do they not get this type of support? And it really read the role in regards to, okay, if you are not part of these communities, these are the things that you need to be thinking of as a provider. Very important. And then it gets down to the bottom and says, well, wait a minute, let's also look at this from a systemic perspective, that it was almost as if somebody discovered our language, Lisa. They discovered our language by thinking in systems and saying that, okay, you and your entire education as a mental health provider probably have been taught that you're fixing a person, that you're assisting the person in fixing themselves, even. When in fact, the literature is stating this language goes all the way back to the 1930s, where it talks about society is ill, and there may be a few things that you can control, Lisa, as the individual that's seeking out a mental health provider. But the illness is primarily the society around you that needs to be fixed. And so, thereby taking the responsibility off of the individual and putting onto the external environment so that they can both work hand in glove. And so, the reason why I appreciated this so much was because I've seen it. I've seen it happen. It's happened, in those workplace conversations that we had previously. Like I know based on what was shared around Dr. Bonnie before her passing, there was a lot of conversation about what performance, being under supported, underfunded, understaffed in order to do the same things that she was always doing, to the point that she went and she actually wrote in her open letter that I am seeking out mental health support, whether it's through some organizations and universities have an employee assistance program, an EAP or something like that. She reached out for help, and she did get her own help that she could afford, but I'm not so sure that society was taking responsibility for being ill as much as she was taking responsibility for trying to get out of a toxic, sick environment. And so, who really wins here? The sick society ends up winning. We have one less Black woman in the world because society is sick amongst everyone else. I'm not diminishing other folks. But, in this particular case, how do we call society into accountability for being problematic? And so let me give you an example of, we're talking about society as being ill and society being a patient. Let me share with you a society as, how can I say, a small microcosm of health within society that I recently saw. So very recently, this sounds tangential, but go with me there, Lisa. I had a friend of mine who lives up in New York City, and he's originally from Maryland, and he posted that, and I had already seen the article about Miss Maryland USA, who will then go on to compete for Miss USA and then possibly Miss Universe, is a transgender woman, right? And so my friend in New York posted the picture with the announcement, congratulations to Miss Maryland USA, and then the background of the winner. And he posted on Facebook, okay, women, okay, ladies, I think it was ladies. Okay, ladies, how do you feel about this? Now, usually I don't go read the comments because they piss me off every single time, right? Usually I don't, but I'm like, again, here's that hope. Here's that hope. I'm hoping that people are going to say and do the right thing, right? So I go into the comments. I am overwhelmingly pleasantly surprised by all the people that I perceive to be women. The men were the toxic ones in that case, but he asked the question of women. And overwhelmingly, if I'm kind of pairing name, my assumption, name and face, the avatar, the women are like, oh, congratulations, good for her, she did it, way to go, da da da, all of these congratulatory uh, comments underneath. The men, there was one comment that I read that was posted by a man that said, who cares what women think? This is messed up and it shouldn't be happening. And like 25 women underneath posted, first of all, whether you agree with it or not, she abided by the rules. The rules are inclusive. So no one's broken any rule here. And just because you feel a certain way about it doesn't mean that it should be a problem. Society was defending this trans woman in a moment where my jaded Black woman, 46-year-old self was thinking, I hope I'm not the only one that chimes in and defends this woman. Tons of people were defending her. Society was not as ill as it usually is in that moment for me. And I saw a little bit of light at the end of the tunnel. But how often do we see that though, Lisa?
Yeah, hardly ever. And I'm like, it's probably not
Right.
representative of society writ large, right? It's like a
Not at all.
subset of people, and it's
Mm-hmm.
Maryland. Um,
Mm-hmm.
so yeah, I really like this because I do think that we are products of our environment and our culture, right? And so the stresses and the concerns and the struggles that we have are not, they don't originate in a bubble, right? In a vacuum. I mean, there are obviously there's genetics, right? But the vast majority, well, maybe that's, I shouldn't say vast majority since I'm not a doctor, but a lot of mental illness or self-esteem or confidence or things like that are not genetic, right? They are socially induced. And it makes me think of the social model of disability, right? That moves away from the medical model of disability that looks at disability as something to be fixed because you are broken, right? Versus the social model of disability is that, well, our environment is broken. Our environment just does not create the conditions where no matter your mobility, learning, you know, activity needs, it accommodates, right? Like, because it's that universal design thing that we always talk about. And so it's like shifting the blame from the individual as being broken to the society is just not inclusive, and it could be, right? So I really like that, it kind of extending that to this society as patient, because we are so quick to go to an individual as the problem, right? Like, you're just not working hard enough. You're just not brave enough. You're not resilient enough. You know, you don't speak up enough, right? You are too much of a snowflake, right? Don't let people influence you so much. I mean, you're too sensitive. I mean, goodness gracious, how many times do we hear that, right? Rather than thinking about these larger systems that are at play.
Mm-hmm.
You know,
Mm-hmm.
I mean, it's just, yeah, I think it's a great way to think about it.
Yeah, yeah. And I have to admit, I have probably walked the very fine line of not doing that as well as I could, and still trying to find that balance, because that's very much the case. I've shared on this podcast before, Lisa, with you, that middle school really sucks, and it really sucks with technology on top of it. And so naming things like, yeah, you go to school with assholes that are bullies, and they say things that are very ugly and very wrong, and they are wrong. And dealing with a system of how to report bullying that is also quite broken. Yet at the same time, holding my son accountable if he doesn't respond the way that we have encouraged him to respond. So, how do you hold all that at the same time? Like, Trey, you're individually responsible for this, but yet we're also asking you to be healthy in a toxic environment. I feel like I'm living it. Like I'm living it when it comes to that piece of the puzzle. So it's a fine line. So I can only imagine, as a mental health provider, how do you do this? I'm trying to figure it out with my own family and own household. So it just sounds like it's a very tough job. But at the same time, if we're not aware of this and we're not critiquing how we're educated as providers, we'll just continuously, you know, proverbially hit the individual over the head with what they need to be doing rather than acknowledging this other piece. So anyhow, all right. Well, on to phase three, Lisa. This is your wheelhouse. I'll get us started, but this is your wheelhouse when it comes to the measurement piece and validating items. So Lisa and I have said consistently that, you know, data analysis, all of that is like our cardio for real. Like we love it. We can get lost in the data for real. And so I was really excited when a good friend of mine who also does similar work sent me a link around the Census Bureau that's using the annual American Community Survey to test items around sexual orientation and gender identity, because you have to test the questions in order to hopefully validate them, and then they can be used more largely, more broadly in the 10-year survey. And so with that, I think what's really cool is that in September of last year, the Census Bureau, they published a Federal Register notice that was seeking public feedback on the testing of these particular items. And so what I appreciate is that they took a lot of care in explaining to people that would be testers what happens with the data. Because of course, when you're asking very sensitive questions of individuals who have been marginalized, and frankly, violence and all levels of that pyramid of hate start to kick in, you have to be very careful to protect the people that have graciously offered their input on your items. And so they detailed all of that. And so Lisa, what I really think is cool is, number one, I feel like an aha moment hit me as soon as I saw this article, when I realized that those questions were not already being asked. Hello, I thought they were being asked already. They clearly are not. That's one piece. And then the other piece is that I appreciate that they still have some work to do, because some of these questions, I cannot wait for them to get some feedback, because some of them just don't have accurate responses to even choose from. But I also appreciate that there's a nexus between, for example, other identities like education, marital status, disability, fertility specifically. And so I just really think that this is promising, that this is even happening. So folks that hopefully are responding, please respond and give them heavy feedback on this, because I want to see it in the next census. So, but Lisa, what do you think about this? And what does your brain kind of tick through if you were the person that was waiting on the feedback?
I don't know. I think I didn't actually know about the American Community Survey, right? So I had to look that up. So it's this annual survey that collects a whole bunch of data about housing and socioeconomic status and employment, et cetera, et cetera. And so it gives that information for the prior 12 months. So these questions are being tested for inclusion in the 2026 American Community Survey, and then presumably, like you said, in the 10-year census in 2030. But yeah, testing of questions is really important. Because there's so much ambiguity in how people understand a question, how you write a question, the words you use, the simplicity of the question, is there bias, right? I noticed that they had reframed a different question. They'd restated it because they felt that there was bias in the way they'd asked about household income, right? Like it was a leading question. And so they reframed the way they did that. So I think it's really an important process. I too was also surprised that gender identity and sexual orientation were not data points that people are collecting. And it sounds like this inclusion is in response to, in particular, a number of employers who are wanting to be able to look at this data kind of in aggregate more broadly. And that feels good to me. I mean, people from marginalized gender identities, and sexual orientations are probably not at all surprised that these questions are not on these kind of widespread national surveys, right? But so 2024 feels late in that sense, I suppose, right? Why aren't we asking these questions? But that they are adding them, that they are testing them, and I'm sure they're going to get some hostile feedback, right? But they're going to forge forward anyway with the inclusion of these questions in 2026 and beyond. That feels good to me. I just actually hope
Mm-hmm.
that it sticks, because we might have a change of administration next year, right? And so all of these kind of data moves that we've talked about on this
Mm-hmm.
pod, like we talked about racial identity previously and how that's being expanded to be more inclusive of Middle East and
Mm-hmm.
North African people, Arab Americans. I
Mm-hmm.
just hope they're not backtracked, right? Because we have a different
Oh,
administration who just
yes.
doesn't see
Oh,
the value in
yes.
collecting this kind of level of granular and important identity data to better
Mm.
understand,
Mm-hmm.
you know,
Mm-hmm.
needs of communities.
Well, now, so Lisa, go with me on this train of documents that I'm figuring out kind of go together. And my brain just clicked on something that you just said. So Lisa and I have done a good bit of work in regards to health equity, and using documents like Healthy People 2030 that gives us the social determinants of health, right? So we've got the Census Bureau broadly. That's one area of this big Venn diagram. The Census Bureau, and then the ACS within that piece of the Venn diagram. Then we have Healthy People 2030, which that gives us social determinants of health. Then we have Health and Human Services, which, Lisa, if you recall, the US Surgeon General published that big document that talked about healthy workplaces, mental well-being and healthy workplaces, that piece. And then on top of that, there's an entire SOGI data action plan that the US Department of Health and Human Services published. I haven't read the whole thing, but I'm aware of it, where it's talking about evidence building. And so what I think is interesting, because this really parallels a lot of what I observed when I was in higher ed, is that the argument oftentimes has been, we don't need to allocate funds. We don't need to allocate space. We don't need to allocate staff to serve these particular populations, as long as we don't have data that they actually exist, right? And so as they're talking about this evidence building piece, it's almost like baseline data collection, Lisa, as we would do in an organization that's never done this type of work before, is that they have to build the baseline before they can then start to argue for specific resources for these communities. You and I know they already exist, but now the Census Bureau is saying, let's shut everybody up and ask the right questions so that we can validate that there are the right questions being asked, the right communities that we have largely ignored for a period of time that we now want to serve. Now, we know there's probably, some politicking, there's some lobbying going on, whatever may have gone on to make that happen, but it's now happening. And so asking questions like this around, sexual orientation and gender identity, what items are we using to ask the questions, right? How is that going to influence resources? How is this going to influence how other people and government agencies, how they collect data? Because I remember this quite a bit, Lisa, when, for example, let's say we were getting federal or state funds to support students, for example, right? And something simple like we want to be able to change the pronoun or change a name or what have you. The government systems that we had to report to did not allow for that, even though that was one of our tenets as a university. And so as the census begins to document the data of the lived experiences of these communities, it would be ideal for the government systems to then change to reflect that they exist, right? So yeah, asking the questions, you know what I always say about any type of assessment and data collection, Lisa, people don't want to ask the questions that they don't want the answers to, meaning that they're not going to ask questions that then hold them accountable for doing something about whatever the data says. Now they're
Oh
going to have
yeah.
to do it.
Now they're going to have to do it. And this is happening at the federal level, right? But then we're not even getting into
Yes.
all 50 states, because there are likely some states that do statewide data collection, right, outside of a census, right? I know
Mm-hmm.
Colorado does like a Healthy Kids Colorado survey, and that covers all types of identity markers and experiences. And that's
Mm-hmm.
almost certainly like not aligned with some of these federal data sets. So then you also have this like apples to oranges comparison, right? When you're trying to take state level data, national data, and you're trying to look for trends, and you can't even compare the two, because one group's
Yeah.
asking for sexual orientation and gender identity, which, just as an aside, that's what SOGI is, SOGI, sexual orientation and gender identity,
Mm-hmm.
for folks who didn't know. And then, and then you can't, so then you don't have good corroboration, right, at these
That's
multi
right.
levels, which then
Mm-hmm.
further creates problems for funding and support in communities, right, when you're trying to make these arguments
Mm-hmm.
as a service provider or something at the local level. So it's pretty
Mm-hmm.
interesting to see like how fractured it is when we're trying to advance equity and inclusion and better understand the diversity of our
Mm-hmm.
communities, when some states and some localities collect it, others don't, and the federal government's like 50 years behind.
Right, right. There you go. Exactly, exactly. And I just took a peek, Lisa. I'm going to drop this particular document from US Department of Health and Human Services in the show notes, but they're asking questions about lots of things that are just public questions that need to be asked, like, to what extent can the federal government promote inclusive environments for LGBTQIA plus people in immigration and asylum systems, for example, or the criminal justice system? What can we do to reduce the disproportionately high rate of violent crime committed against these groups? Children, youth, families. I'm just kind of skimming here, Lisa. Um, what can the federal government do to support these particular communities uh, in shared public spaces that provide services like transportation, right? This is huge. This is a big deal. And so, again, even posing the question calls accountability. And so, when Lisa and I kind of geek out over data collection is because we know how powerful it can be to even ask the question, then to answer the question, and then what are you going to do about the answer that you get, regardless of what it is? If you're not ready to be accountable, then most organizations don't ask. So
Yeah. Yeah.
revolutionary stuff going on here.
I know. Sad that it's revolutionary at this day and age, but it is. So
Exactly.
we will put some links in the show notes if you want to go to the Federal Register. I think that you can go ahead and provide feedback on the proposed test questions if
Mm.
you have an interest in that. One of the way that democracy works is before things are created, rules go into effect. They ask the general public, but you got to engage in the process, right?
Mm-hmm.
So
Exactly. That's right.
we will include those links in the show notes. But I think that's a wrap for this week, Dr. Shaunna. So where can
Uh,
folks find us on the interwebs?
right, because look, they're not going to find us at home because we've got places to be and planes to catch and all the things, right? But where you can find the pod, certainly you can find us at YouTube. You can find us on Apple Podcasts and Spotify, Instagram, we're there, LinkedIn, we are also there. Info@unfazedpodcast.com is a great place to drop all your questions, comments, concerns, you name it. You can drop it there and we can address it on air. And then, of course, the website, unfazedpodcast.com, where you can find both the new and the old shows. So please share, like, subscribe, leave a review. Please share this with all of your friends, your coworkers, and anyone else in this phase of your life. So, Dr. Lisa, until next time.
Until next time.